The widespread shortage of healthcare workers is also raising questions about the province's plan to expel patients from hospitals to make way for a potential wave of COVID and flu patients. But those responsible for caring for those patients weren't told about the plan nor asked if it's even possible. CTV's Penny Daflos joins us. Penny, so there's a name for this. It's actually called decanting hospitals.
Yeah, and decanting is a euphemism for discharging or expelling patients because there are other people who need that hospital bed even more. But that initial patient may still need care, and they may not be able to get it at the level they need after they're sent away.
It's the time of year more people start getting sick, and this fall officials are expecting both COVID and influenza to hit hard.
The worst case, we might start seeing a surge at the same time.
The day after that warning, a climb in COVID hospitalizations for the first time in months, suggesting the next wave may be here even earlier than expected. The solution is to expel nearly 1 in 3 patients, 500 of them earmarked for care homes.
I'm not sure if it's attainable. We just don't have the people.
Not only that, neither BC care home operators nor nurses were consulted.
We were quite surprised to hear the announcement
About the plan to free up hospital beds for COVID and flu patients, and they're worried it could turn into a situation like Ontario, which is making a similar move.
Patients of ours could be sent a long distance away, far away from their families, which would leave them at risk and, leave them to suffer more.
Is that going to happen here? We don't know because we haven't been brought into these discussions.
Some 1,200 patients could be sent to their homes, which poses its own challenges.
either other patients are going to get deferred, or these patients are going to take a lot longer getting into the system, and it's going to have an impact on their families and their loved ones.
Nobody showed up. I was not notified as a family member that my mom was not going to be receiving care.
Marianne Lush is paraplegic and legally blind with terminal cancer. Twice her caregivers didn't show up.
She would have been laying in bed in pain,
which the provider blames on miscommunication and staffing shortages.
We're working, and we'll be working with care providers and with people to ensure that our care homes that currently have fewer than the capacity of people in them, of residents in them, that will be able to work to that capacity so that we can in fact decant.
So Penny, a lot of unanswered questions like if there was capacity for at-home care or if there were care home spaces, wouldn't patients already be there?
That's really the crux of this, mi-jung. Again, we're talking about, think about it, nearly 1 in 3 patients in hospital who probably shouldn't be there, but there simply aren't enough healthcare workers and no time to train more in the next month or two before the expected surge. I really do expect that we'll start hearing even more stories about gaps in care or families stepping up, or even more sadly, people sent home with no scheduled support at all.
Yeah, crucial time right now. Okay, thank you, Penny.